I'm Dr. Scott Nelson of the Eye Care and Surgery Center. Today we're going to take you through a LASIK consult, discuss your surgical options, and let you know what you can expect if you're a good candidate for LASIK surgery.
I came today to see if I would be a candidate for LASIK eye surgery.
Well, everything looks good with your exam. I think you'd be a really good candidate for the surgery. All the checkpoints that we're looking for look great, so I think you'd be an excellent candidate for LASIK.
Okay, so what are my options?
LASIK is probably the best option for somebody in your situation. The PRK procedure is the same thing as LASIK, but without creating the flap. In your particular case, I think LASIK would be your best choice and probably the most comfortable and safe procedure.
So is the procedure painful?
The procedure itself is not painful at all. There's a little bit of pressure sensation briefly, but other than that, there's really no significant discomfort.
Okay.
I usually compare it to people if I say, well, if I was going to reach out and shake your hand, I mean, you can feel me shake it, but there's no pain with it.
Are there any restrictions afterward?
Immediately following the surgery, we'll tape some little clear plastic shields over your eyes so you don't accidentally bump them or rub them, right when you get home. Other than that, you really don't have a lot of restrictions. You're going to put drops in for the first several days, but activity-wise, as long as you don't rub hard on your eyes, you can pretty much resume your regular activities.
How long does the procedure take?
The procedure itself, start to finish, usually takes about 15 minutes. A lot of that time is kind of waiting and watching and letting the flap seal, that sort of thing, but really pretty short overall, only around 15 minutes.
So how long would I be out of work?
As far as work goes, we'll do the procedure on one day and you'll pretty much be out that day.
Sounds great.
We'll see you the next morning, and if everything looks good, we'd probably release you to do just about anything you want. So certainly the day of surgery and the morning after, but otherwise there's really not much downtime with the LASIK procedure. The Vizx Star 4 laser is the latest and probably most advanced treatment system for LASIK. We've had that laser here in place for the past several years, and we believe it's the best treatment option for all our LASIK patients. We have several options here in creating the flap for LASIK. We use the microkeratome, which we've used for years and creates an excellent flap. We also have the option of using the intralase. The intralase uses a laser to create the flap. This gives us a few other options that maybe some ways to customize the treatment a little bit more for the individual. Okay, well, tell me how things are going so far.
Things are going fantastic. I am thoroughly enjoying not having to have glasses. It's so nice to pick up just a magazine, to be able to read an article, not to have to worry about going searching for my glasses to do so. Driving, my vision has improved with that. Yeah. It's just been overall a great experience. I'm enjoying the results.
How's your nighttime vision doing so far?
It's been doing okay. I do have a little halo effect, but not too much to where it's, hindering my ability to see and drive at night. So it hasn't been that bad at all.
Good. Well, that's what we'd expect at this point. And over the next couple of months, we expect that to get even better. Okay.
Dr. Nelson, I want to say thank you so much for changing my life. I feel from the time I walked in here for my pre-op visit, the staff was so friendly. You did everything you could for me to ask questions. Were very patient in answering them to where I felt comfortable enough and had absolutely no reservation in having the surgery, and it's the best thing I ever did. The only thing I regret is that I didn't do it sooner.
To see if you are a good candidate for LASIK, call Eye Surgery Center at 923-0960.